We all are only 1 degree removed from knowing someone who is being impacted by workplace violence or some form of online exploitation. This issue filters into employee wellness, impacting engagement at work. Let's bridge this gap by bringing awareness and education to these pressing issues and shield the vulnerable. Welcome, everybody, to Shield the Vulnerable, Untold Stories. I have an amazing guest with us here today. It is Wendy Glass. Wendy, you are the founder of Ignite Leadership and Human Resource Consulting. You are better known as cultivating employers of choice, and you work as a fractional chief human resource officer. We're here to talk today all about workplace violence in healthcare. So thank you, Wendy, for joining us today. You're an adjunct professor at Virginia Tech. You've got a spot on WDBJ Channel 7 in Roanoke, Virginia, called Here at Home, which is an on-air show for women, workplace segment for women in the workplace. So you got your hands tied into a lot of things, but I know that the topic of healthcare and leadership is something that is super important to you, something that you are extremely, extremely passionate about. So Wendy, thank you for being here today.
Thank you for having me, Dave. I'm really excited to be able to talk about this really important topic.
Yeah, well, it is. And so when we look, and there's new stats out that I was reviewing recently about the rising rates of prevalence of violence in healthcare, violence in the workplace, something that we're super passionate about talking about. But we know that healthcare is one of the highest industries for workplace violence. I read a stat recently when I was doing some further research on it that said 91% of ER doctors have been a part of or have witnessed workplace violence. And it transcends across, it doesn't matter your role in healthcare, it doesn't matter what department you work in. You can be in administration in a hospital, you can work in the emergency department, you can work in psychiatric, maternity, doesn't matter. And violence encompasses a lot of different things, from threats of violence to actual acts of violence. But the one area that I know that you are really passionate about is the topic of lateral violence, which is kind of that employee on employee violence, which is really rising.
It really is, Dave. It's a funny story. My background, I spent almost 2 decades in healthcare. I was an HR leader in healthcare. And so I got to see firsthand some of the impacts. And I'll never forget, many years ago, I got a call. It was my first leadership role in a hospital. And I got a call from our chief nursing officer saying, Wendy, I really want to do some work around lateral violence. And I'm new. And I literally had been in the role for maybe a couple of months and new to leadership. And so I was like, absolutely, let me look and see what we can find. I had no idea what she was talking about. I had worked in healthcare for 10 years up to that point, but I never heard it because I wasn't in that leadership role. And so I quickly jumped on our favorite tool of Google and understood that really it's nothing more than bullying in the workplace. And it was a little surprising to me at that time in my career to think, wow, we're adults. Why are we talking about this? And it was shocking to me, but it is certainly a challenge. And it's not getting better. And I have a lot of reasons why I think that is. And so we can talk about those.
Why do you think it is? Why is it not getting better?
I think that healthcare has a culture of allowing it. I think is one of the biggest challenges. I think another thing that is really contributing to it is the shortage of healthcare professionals. It's getting worse. It's not getting better. So there's a lot more regulations coming out over the last 10, 15, 20 years that healthcare organizations have to comply with. And so you think about having to do more with less people, the stress of working in that field is not getting better. And then
they're taking it out on their coworkers?
I think they do. I think that they allow the stress of the job. People are sicker, at least in the US, people are way sicker than they were 20, 30 years ago. And I think that they take it out on their peers, but there's this underlying current that's been allowed for I don't know how long, is for years and years and years, that we tolerate it. We permit that kind of behavior in healthcare. And I heard from a really phenomenal CEO once, what you permit, you promote. And so, therefore, in my opinion, they're permitting it and therefore they're promoting it.
Right. With healthcare, I know one thing there is it's highly underreported. A lot of employees, depending on where they work, they just kind of sum things up as going, it's the inherent risks of the job. And that may be more with violence coming from patients or family in different levels, so they don't report it. I mean, it could be as simple as somebody getting in somebody's face to a shove to a push, but we're seeing this escalating pattern of behavior, right? Which starts as somebody just being agitated today. If they stay in the system, if they stay angry with the system, it can perpetuate and get to that point where it now becomes physical violence, or we lead into active shooter incidents. I mean, there was one even most recently, it was February of this year of 2025 at the University of Pennsylvania Medical Center. It was a hostage situation in an ICU. A police officer lost his life as a result. There were several doctors, nursing staff that were injured. But we look at things and they just don't always end on that first incident. And even though I'm talking, in this case with UPMC that happened is an outsider coming in, laterally, internally, these things happen too, where, you say what we permit, we promote. Is there a cultural fear when it comes to violence of leadership going, if I address this, if I single a person out, if I have to have that difficult conversation with them, that this could escalate further? Is that why they're permitting it? Or are they permitting it because of poor leadership skills? Are they permitting it because they don't know where to turn and it's just easier to turn a blind eye? Like what's the culture? What's happening with it?
So I don't know that they permit it because they are fearful that it could escalate into more extreme levels of violence. What I heard, even from a very, very young professional in HR in the healthcare setting, is, well, they're a good nurse, but. And so if you think about that shortage of staff, shortage of nurses that we
Okay.
talked about, you have these individuals that are really good clinicians. And we as in leadership within healthcare, we struggle to separate a good clinician from a good employee. They're not the same thing. I was so fortunate to work with an individual. His name was John. He was a colleague, a mentor, and then became my supervisor over time. And he was probably one of the first people that taught me, if those two things don't go together, you can't be a bully and be a good employee. You may be a good clinician, but if you're not good to your coworkers, then you're not a good employee. And so I
Yeah.
think that probably drives a lot of it. I think they're already working short staffed. And if they start terminating or holding, maybe you don't go straight to termination. If you start holding people accountable for their behavior, then they may leave. And then you're going to have one more skilled nurse down. So I think that's
Right.
a huge underlying problem.
I like how you put that with the yeah, but, right? You can call it, we got the yeah, buts, right? Like this person's good, but, right? And I think when you're saying, they're a good clinician, but they're not a good employee, that that goes into all sorts of industries, even outside of healthcare. This person is really good at this, but now here's the problem, right? Because if we're permitting it, which means we're probably not documenting it. And now you get these layers, these added upon incidents. And let's say there is a big blow up or something really happens. And the big blow up may not be. So let's say I'm the workplace bully and my target is Wendy. And I'm after Wendy every single day and nobody's documenting this. And then one day Wendy loses her mind. On me, on everybody. She's had enough of being bullied in this culture. Nothing's been documented. Wendy loses it. And now Wendy is the bad guy. Wendy is the one who took it to that extreme level. So it's not always the bully themselves that elevate to that extreme and go to that level of higher propensity for violence. It's the people who are being bullied, that the culture allows it to happen. They promote it from happening within, even unintentional promotion. And the people who are being targeted become the ones now who go to that next level. And it's something I think that leadership needs to take note of and saying, yes, we are short in staff, but we're not going to allow this culture anymore. So on that topic of
You
you
know,
being,
the interesting thing, Dave, though, is that some of these nursing leaders, I mean, when we look at lateral violence or horizontal violence or workplace bullying, in a lot of ways, the true definition is it's aggression or those harmful behaviors laterally with people that are of you know, equal seniority, I guess or nurse versus nurse. If you look at the age of nursing leadership today, we have a lot of young nurse managers, and even some of the managers, honestly, are being bullied by some of your more, tenured
senior
nurses that
staff,
chose never to promote. But yeah, it's a problem.
and they don't know where to go. They don't know where to turn. And you said, so one thing you had said previously to me was that leaders are afraid to be vulnerable and allow trusting relationships to form. Is that part of that? Like, is that young nurse manager or supervisor the person that's afraid to be vulnerable? Are they trying to seek the approval of the old, hardened, good clinicians, but people that aren't good employees? Like, what's that relationship there? Why aren't they addressing it?
I think certainly vulnerability in the workplace, leaders being willing to be vulnerable. There was a study that was done in the height of the pandemic, or, maybe it was as we were coming out of the pandemic, and I don't even remember who did the study, but it talked about well-being in the workplace, which is, by the way, a significant side effect of that lateral violence is well-being, which then leads to engagement, so that it all just kind of connects. But employees were asked, and these weren't just healthcare organizations, but employees in various industries were asked, how are you doing? And only about 40 or so percent said, my well-being's good. They asked the leaders of those same employees, how are your employees doing? And about 80%, they said about 80% of my employees are doing really well. And so that's a huge disconnect between 40 and 80. And so then they dug in a little bit deeper, and they said, well, how are you doing as a C-suite? And the C-suite leaders, only about 60 or so percent said they're doing okay. And as this organization that was surveyed dug a little deeper, what they really kind of peeled back the layers, realized is if you as a C-suite are not doing okay, but you think that your employees are, where's the disconnect? Maybe you as a leader aren't being vulnerable enough with your employees and saying, look, I'm struggling too. Let's talk about it. And I think that's that pie in the sky leadership where you think everything's just good. Well, it's because you're not connecting with your team members and you're not sharing in an appropriate way. Like, look, I know this is hard. I know this is challenging. And so, that we've built this culture where we're fearful of sharing how we're feeling. Being vulnerable is not oversharing.
Is there a disconnect there? There's that saying it's lonely at the top, or it gets lonelier at the top, right? And is there that disconnect there where a C-suite's going to say, I'm not going to be vulnerable and share that, because when I do this, we're going to get another, case of the yeah buts from people going, yeah, but you're a leader here. You're a C-suite. This is what you signed up for, right? If you can't handle that stress, like, don't be here. Oh, Wendy's showing her vulnerability as a leader. Can we trust her as a leader? Like, she should be solid as a rock. Is that the perception that other employees may have of C-suite going, like, these people can't show vulnerability, and so therefore the C-suite also adopts that mindset or belief?
I think that you're always going to have a core group of what I refer to as energy vampires in the workplace. It comes from John Gordon's Energy Vampire book. It's not my I didn't coin the phrase, but you're always going to have a group of energy vampires in the workplace that are going to find, it doesn't matter what you do as a leader, they're going to find fault with it. But I've seen it literally in action. The leaders that are human The leaders who get to know their team members on a personal level and show that they care about them more as a person and not just an employee, those are the leaders that have the better outcomes in healthcare. They have higher engagement, they have lower falls, lower infections, because their employees show up differently. They show up with that discretionary effort because they know, hey, my leader cares about me, and therefore I care about being here and taking really good care of our patients.
Yeah. And when I talk to people about that topic on leadership, just exactly what you said, I'm like, we just have to humanize things. Everything doesn't have to be mechanical. It doesn't have to be work related. If I know Wendy's kid is off to college or university, like it's just small touch points that we have to make, right? Yeah. If you're going to be a leader, if you're going to sign up to be a leader and put yourself out there, you have to take more on. You kind of have to like open up your bandwidth a little bit and go, I might have to remember a little bit more, or I got to, pay attention a little bit more closely to show individual people that I care about them beyond them showing up here for a paycheck. And that's that step, like that gap that we have to bridge. I think it's Stephen Covey, David Covey, that's like, people don't care how much you know until they know how much you care type of saying. And we have to show that level of care to people all the time, right? People are
We do.
leaving.
I mean, people, like, you think about it. We spend more time at work than we do at home. And work should be enjoyable. That doesn't
Yeah.
mean that every single day is going to be perfect. Perfect is such a subjective term anyway, but you should be able to go to work on a daily basis and generally know that it's going to be an okay day. It may be harder than yesterday, but you're not going to have people that are, intentionally not helping you because you're a younger nurse. My daughter's a nurse, and so she's she's been in it for 2 years now, and so she's technically no longer considered a new nurse. I guarantee you there's lots of things that she doesn't know yet because she hasn't experienced it. She's an ER nurse. And you said a stat earlier, 91% of ER docs. There's another stat that was done. So anywhere from 44 to 85% of registered nurses have experienced lateral violence at some level, and 93% of all healthcare workers report having at least witnessed it. And so I don't know where I was going with this, but yeah, like, you have to know that when you get to work, people are going to have your back. Healthcare's hard. It is really hard. It's hard
Draining.
work.
It's emotionally draining. It's physically draining.
You're right. And some days are worse than others. The last thing that you should have to deal with is a leader that's aloof and doesn't care about you, or coworkers that basically have this sink or swim mentality. That is why our healthcare organizations continue to suffer, and they're not digging out of this hole, because people don't want to work in those environments.
Yeah. Well, so when it used to be a noble calling, right? 30 years ago, you signed up to become a nurse, an ER nurse, and you were an ER nurse for life. Or maybe there was internal movement, going from the ER to an ICU or another ward or something like that. But people were committed to a 30, 35-year career. Law enforcement was the same.
Yep.
Now, they're looking for an out. More jobs exist today than they ever did before in the online world. People can take all of their skill sets, transition them into other lines of work. I mean, I spent 15 years in law enforcement myself, decided that it wasn't as much as I loved the career, I loved everything about it, but it was like a total love-hate, and that risk reward was gone. And so I'm like, well, what other skill sets have I acquired over the last 15 years? What am I certified in? What am I trained in? What have I experienced? And how can I now transition that and put it into some other use? So people have these options now. I don't think anymore people are signing up saying, I'm going to be here for 30 years, or maybe with good intention. You just said your daughter's a couple of years on working as an ER nurse. Her intention may be out the gate. Like when I first started, there was 30 years wasn't going to be enough. I needed 40 years in my mind to go and conquer the world and do all the things I was going to do in that career. People kind of hit a point and a breaking point and go like, is this worth it? Is it worth my health? Is it worth my mental health, my emotional health?
Well, and I think in the nursing profession specifically, there's even more at stake now too, because this is completely off topic and probably not a rabbit hole you want to go down with me, but we're starting to now criminally charge in the US. We're criminally charging nurses for errors that cause adverse impact on patient outcome. And so, what we're hearing a lot of, and even I heard it from my child over the weekend, is that's my license that's at risk. I
Yeah.
mean, I can personally be held criminally liable when they're being put in situations that are not tenable for anyone.
Well,
If
let's
we
go down
had,
it for a second.
I'm sorry.
Because I said, I just want to, I want to touch on that just for a second, because I do want to go down that rabbit hole. Because what about the errors that are created from the person who is constantly being targeted, being bullied? They're working in a state of fear. And so their head's not in the game. I get it. Like, there has to be some level of consequence to, because I know if that's me in the hospital or a loved one, and there's an error that's made, yeah, there's got to be accountability. But what's behind it? Where does that error come from?
Well, I worked for a regional healthcare system here in Southwest Virginia early in my career, and they approached. So we have to be honest. If it's our mom, our dad, our loved one, we expect there to be zero errors. That's our loved one, and that's a reasonable expectation as a loved one. But people are human. They're going
Mm-hmm.
to make mistakes. A lot of what I've seen, and there was a nurse in Tennessee that was criminally charged and found guilty, lost her nursing license. But if you look at the system and the process that was in place, she was literally set up to fail. So there are so many checks and balances in place where, like, medication scans and that kind of thing. Well, this particular nurse, and I don't remember her name, she was not in her normal unit. She had to go with a patient that was going to get imaging done. The patient coded or something, and she was pulling meds from a Pyxis or a medication machine she wasn't used to. They didn't have the scanner that would normally be like, whoa, stop, this is not the right error or right dose or the right medication. So there's a lot of processes, but yeah, there are people, like, think about it. If you're constantly living in stressful environment, not because of the work itself, but because of the people you work with, that has a direct impact on your own well-being. But we adopted a model. It's called Just Culture, where when there was an error in medicine in any of our departments, we would look and say, okay, what was the error? Was this a result of negligent behavior, or was this a result of something else? Were they working short staffed? Were they in a wrong unit? And then we used an algorithm to help us better determine it wasn't all punitive immediately. You can't because then you have this thing in healthcare when you have very skilled and caring healthcare professionals that make mistakes called the second victim. And
Mistakes called the
basically
second victim.
the second victim. And so, like, if I'm the nurse and I give you the wrong level of medication and it causes an adverse effect on you, um, that can impact me too. And so, Just Culture was a really powerful way to be able to ensure that we were treating our employees fairly and using it almost as a way to identify when there were processes in place that didn't align with safe patient care. And so, you can't, as a healthcare leader, you cannot immediately go to punitive action when a person makes a mistake because they're human.
How quickly, though, are healthcares to want to cover healthcare institutions wanting to cover up a mistake made for fear of greater liability? And we know the saying, shit rolls downhill.
Yeah.
That they're going to dump it on the person who made the mistake in the first place and hope that that liability then does not filter any further into the system, into administration, into the organization itself.
Yeah, I think that is probably very dependent on how effective the leader is. I've worked for nursing executives or with nursing executives that would literally go to the mat for their nurses and their patient care techs and anyone else that was a really strong employee, a really committed and good employee. I've also worked for nursing executives that listen, they were going to protect themselves above all else. And so it really comes down to a leadership issue. I would say at least all healthcare organizations that I've been involved in, they really have embraced this culture of high reliability. And basically that says that You report if you see something, say something. If you do something, say something, because it's through that we can learn. My experience, I mean, I've worked in multiple different hospitals, but just really with two systems, and both of those embrace that. But I don't know that all organizations do, or maybe they say they do, but when the rubber hits the road, do they truly? Like Vanderbilt University in Tennessee, that literally the woman that was criminally charged, they did not have her back. I mean, they at all. And
Right.
so, and she even reported the error almost immediately, well before, a criminal investigation started. So I think it starts at the top. Do you actually practice what you preach?
Yeah. And that's coming from a major organization like Vanderbilt.
Oh yeah.
Wow. Wow. So from your perspective, right, you're known as cultivating employers of choice. You work as a fractional CHRO. One, for the employees, those working in healthcare, those that are new nurses, what are your top 2 to 3 tips that you can give them to help protect themselves in the workplace? And then number 2, for those who are in leadership, and maybe those who are new to leadership or who are really struggling to find their place there, top 2 to 3 tips for them to help strengthen the culture of leadership within healthcare so we can start to work towards minimizing the risks and the incidents of all kinds of workplace violence in healthcare.
Yeah. I would say so. So let me start with leaders first. Is that okay?
Sure.
Because it has to start there.
Yeah.
Leaders have got to realize that they've got to get to know their team members. There are things that they can do. And what I would hear often in the healthcare setting is, well, I mean, when am I supposed to do this? I also have to, make sure I'm managing budget. I have to round on my every patient every day. Like I have all these things. And what I always try to help leaders understand is I understand you're busy, but how much of the work you're doing is reactive because you don't have appropriate staffing. And so, one of the things I do, like in my business, when I'm working with organizations, is I help leaders understand just some fundamental things about leadership. How do you, as a leader, lead and manage well, because really you have to be able to do both. I help them learn how do you cultivate that culture of engagement. And it starts with, very simple one-on-one employee meetings. You mentioned it earlier, but I tell leaders you should have a face-to-face meeting with your team, every person on your team once a month. And you should ask some very structured questions that are designed to help you proactively identify issues. You have to follow up on things you learn, and then you have to really lead from the front, meaning that you have to insist that we're going to function as a really cohesive team. And together in doing this, we're going to provide excellent service to our patients, client, customers, whoever you're serving. So it has to start there, because if the culture is not conducive to what I'm about to say, it doesn't work. For the employees, you have to be confident in using your voice. You do not have to be a skilled nurse or nurse tech or a radiology person or lab person to be able to appropriately speak up for yourself. I was actually looking at some data before you and I got on, because I'm seeing a difference in the Gen Z, those that are that kind of the 19 to 26, 7-year-olds. They are more willing to speak up. And even my own daughter, like she's 20, just turned 27. She will not tolerate people being inappropriate, like disrespectful or rude to her. It probably takes her a little bit longer than it might me to speak up, but use your voice. If you're in an environment where you are not getting what you need to learn the skill of your profession, you need to be telling your leader, and you need to be doing it timely. Don't wait until you're literally thinking.
Yeah.
Every healthcare organization that I'm aware of has adverse event reporting systems. And you're right, you mentioned it earlier, it's often underreported. Those systems are typically built to allow you to report anything that did not follow policy and or that went wrong. And so most organizations have, respectful workplace policies. And so if you have physicians that are screaming at you, or if you have coworkers that are, leaving you with more patients than you need, than you should have, you need to be reporting those. That those kind of things are going to be critical documentation. Should you find yourself in a position where maybe you do have an error that causes an adverse event on a patient, because maybe your charge nurse is a bully and gave you 2 or 3 more patients than you really should have been taken care of.
Right. Yeah. What two things that I really, really like there? One from the leadership side was having the regular meetings, but those are only good if you're going to follow through.
You
If
have to
you
follow up.
have to, as soon as you don't, you lose the trust. And
Yeah.
people then aren't going to open up. They're not going to be vulnerable. They're not going to tell you how they feel because they know you're not going to act on it. So if you are a leader, you must follow up or follow through, or at least show them that you're willing to explore it and let's discuss it. And if you're not, don't feed them a line of BS and say, great idea, Wendy, we're going to do that, when you have no intention to. If you don't like it, talk to them about it. Like if they're being vulnerable enough to you to tell you what they think and feel, be vulnerable yourself if you don't agree, and have a constructive conversation around it.
Yeah.
You're going to do it, and you say you're going to do it, do it.
One of the tools that I give clients that are companies that I'm working with, and this is, it actually came, the idea behind one-on-ones, I believe, started in healthcare, and it started around Clint Studer's work in healthcare around, he called it employee rounding, connecting it to like, well, doctors round on their patients every day. What if managers rounded on their employees on a regular basis? But we always use a stoplight report, which basically you have your one-on-ones with your employees, and then every month you produce a stoplight report, and it literally looks like a traffic light. So in the green are the things that your employees told you, or projects that you're working on that you were able to bring to, implement and sustain.
Yeah.
In the yellow were items that perhaps employees had shared with you, or that you learned about, in staff meetings or whatever, that you're working on, but they're not finalized yet. And then in the red are the things that, listen, you said this was important to you, and I'll give you just an example that I saw often, like employees wanting raises, they wanting, higher shift differentials for taking charge as a nurse. They wanted higher compensation for doing that. That was I was a part of the largest for-profit healthcare system in the United States. And so that wasn't a siloed decision we could make in hospital, but we didn't ignore it. So our nursing leaders put it on their stoplight report in the red category and said, we can't do this right now, but here's why. And so that builds that in itself is vulnerability, right? Like acknowledging, instead of sticking your head in the sand, acknowledging, like, I know this is important to you and we can't do it, but let me tell you why. Yeah. And they still may not like the answer, Dave, but they're at least going to have a different level of respect for you for acknowledging, like, hey, I hear you. I can't do anything about it, but I want you to know that I did hear you and here's why I can't.
People want to feel heard. They want to feel heard, right? When it comes to employees and being able to speak up and have that vulnerability and not waiting till it's too late, I know, like, I've spent a lot of time in the ER, nowhere near as much time as like an ER nurse themselves. And I got, one of my best friends is an ER doctor. The stories that come out of there, like over a 30-year career, like as stressful as that job can be, you can walk away with a lot of fun, a lifetime of stories that will entertain people beyond, you could be the hit at any party if you wanted to sit there and tell, like, for instance, stories like when people come out, right? And so for people, if you learn to speak up early on, right? Like you're in a job where you need a life jacket all the time. So you're floating, so you're staying, so you can stay above water. You don't want to wait until you have to have somebody throw you a life preserver and hopefully stop you from drowning, because it can be such an amazing, rewarding, oftentimes thankless job that people do. And all levels of healthcare, not just to the ER, not just to a psychiatric ward, not just to the ICU, like people doing in-home healthcare, long-term healthcare, all these things. It can be such a thankless job, but it can be so rewarding. But we just, we have to change that culture. where we don't permit it anymore.
Yeah.
So
Because if you do, you are promoting.
that's right. Yeah. Wendy, where can people find you at? Where can our listeners find you?
Yeah, so I'm on LinkedIn at Coach Wendy Glass. So, certainly follow me on there. My website is at www.igniteleadershipcoach.com. I typically post blogs a couple of times a month. And so, yeah, look me up on LinkedIn or on my website.
Awesome. Wendy, thank you for being not only an amazing guest, but somebody who is focused on transitioning the landscape of leadership, for your ties, beliefs into bringing healthcare violence, lateral violence to an end, right? And just being a voice for, sometimes those who need to learn to speak up need somebody who can be a voice for them first and know that they can and that they can find that. So for our audience, whether you're in healthcare yourself, whether you are a leader yourself, whether you're a healthcare employee and has faced this or seen this, you know that you can be the voice to end violence. If you see violence, even if you're not in a leadership position, and you think that that person who is being targeted cannot stand up for themselves, you can still be that voice for them. You can help bring this to an end. If you learned something today, if it was valuable, please tell somebody, please share a podcast about shielding the vulnerable, helping those who need a little bit more protection in their life. So this was another amazing episode. Wendy, thank you again for joining us today and being a great guest.
Thanks for having me.
We'll see you next time.